In this video, we learn about hemolytic uremic syndrome or HUS. It's a life-threatening condition, especially in children, which is often triggered by foodborne infections. To understand the pathophysiology of a typical hemolytic uremic syndrome, initially there is an infection produced by Shiga toxin producing E. coli. The strain number which causes HUS is E. coli 0157H7. So this is an E. coli which produces Shiga toxin. Now this Shiga toxin damages the endothelial cells, especially the renal capillaries. So we all know whenever any capillaries is injured, the RBCs which are passing through these damaged capillaries gets fragmented, and this RBC fragmentation is called as schistocytes. These are the cells visible in the peripheral smear. So you can see here damaged RBCs or fragmented RBCs, which we call it as schistocytes. It's very typical in HUS. Now, since there is an endothelial injury, now you all know whenever endothelial injury happens, platelets get activated, and these platelets will be all the platelets will be recruited and they form microthrombi. So because of platelet activation, there is formation of microthrombi. Finally, what happens is the platelet number reduces because all the platelets are getting used up, right? So platelets are getting consumed more and more for thrombi formation. That's why it leads to thrombocytopenia. And when there is a lot of thrombus or clot formation inside the blood vessels, the filtration process in the kidney is affected, and that leads to what is called as acute kidney injury. So just to revise again, when the baby gets infected or the child gets infected with E. coli strain 0157H7, this strain produces Shiga toxin which damages the endothelial cells. When a normal RBCs pass through these damaged endothelial cells or the renal capillaries, the RBCs get fragmented. So you can see schistocytes in the peripheral smear. Since there is a capillary injury, platelets are needed to block those injuries now or help in healing process. So these platelets will form lot of microthrombi. A lot of platelet is getting consumed. So platelet consumption will lead to thrombocytopenia, and all these microthrombi can block the filtration process in the kidney, leading to acute kidney injury. Now, so what is the pathophysiology is when a baby gets infected with E. coli, the patient presents with bloody diarrhea. Followed by that, patient has these three common symptoms. One is hemolytic anemia, or RBCs are getting broken because of the damaged capillaries, and the damage is because of the Shiga toxin produced by E. coli. And also there is a lot of platelet consumption to block these injured blood vessels that leads to thrombocytopenia, and these there are also production of lot of microthrombi, and that causes acute kidney injury. So in a typical hemolytic uremic syndrome, you can remember the mnemonic or a triad is MAT. Okay, the HUS triad is, it has microangiopathic hemolytic anemia. So you can see schistocytes in the peripheral smear. Patient also develops a lot of microthrombi that finally leads to thrombocytopenia, and because of that, which finally that will lead to acute kidney injury. So you can remember a triad of MAT, that is microangiopathic hemolytic anemia, acute kidney injury, and thrombocytopenia. So there are different types of HUS. Typical HUS meaning when a patient presents with bloody diarrhea, followed by that if he develops a HUS, that's a typical HUS. In atypical HUS, there won't be any history of the bloody diarrhea. So this is mainly, atypical HUS is mainly because of complement dysregulation. Secondary HUS meaning here the hemolytic uremic syndrome is secondary to some other diseases, or maybe because of secondary to some drug intake or something like that. Okay, so you can identify some cause for HUS, that is your secondary HUS. So this is about hemolytic uremic syndrome. So you can understand by the term itself, there is hemolysis and there is uremia. Uremia is nothing but increase in renal parameters like RFT, uremia, uric acid, everything is raised. Okay, that we call it as uremia. So there is hemolysis and uremia, and that happens because of the E. coli infection that is producing Shiga toxin that damages your renal capillaries. Thank you.